I underwent laser treatment for my swollen gums yesterday. Since this morning, I've noticed that the treated area has turned yellow. Could this be an indication of infection? Is it necessary for me to schedule a checkup, or should I start taking medication for an infection? They're freaking out, doctor.
Yeah, well, sometimes patients freak out, right? Like they're because they either, this is what we say, whenever you guys come in for treatment, we go through like a bunch of information. Sometimes it is very overwhelming. You may not completely understand, and you may not fully like know exactly what is going to happen. Although we may be going over some instruction, you may that particular part may or may not have been covered, and so, uh, speaking of that, so going to what you're asking is you underwent the laser treatment. Now your gums are starting to turn yellow. It is part and parcel of the healing process. There is nothing to be concerned about. Sometimes what happens is, what we call it as a healing tissue. Sometimes because the gum tissue or your mouth is completely wet, some of this healing tissue may turn out to be yellow. Either sometime it may completely die off and it may completely become normal, or it will start get better over a period of time. So if it does not get better, more than likely you will be going to your dentist for a follow-up or your periodontist for a follow-up in the next like about a week or two. If it is still a concern, talk to them, and they should be able to help you. In the meantime, I don't think you really need to be concerned about, unless you are starting to hurt and then you're starting to see the gum tissue completely starting to recede. You got severe sensitivity that you are not able to manage, then only then I will be concerned. Otherwise, talk to your dentist when you go back, and your periodontist, and they should be able to help you.
Perfect.